Well, welcome everybody. It's absolutely brilliant to see you on this wintry, but I hope for you actually sunny morning. Just before we get going properly, a few short points of housekeeping. You'll be familiar with all of this, I'm sure, but what we're going to be doing, if this is okay, is recording today's session for those people who couldn't make it. We're going to be recording mostly in speaker view, so that should mean that the majority of the screen is the person speaking, but obviously if you're more comfortable with your video camera switched off, that's completely fine. If you could please keep your microphone on mute during the presentations, that'll just really help with the sound quality for everybody. And we absolutely welcome questions throughout the whole of our session together, but if you could please put them in the chat. I hope you can see the chat function at the bottom of the screen, and we'll be monitoring that and make sure we address as many of the questions as we can, either straight away or in our follow-up or in some shape or form. So thank you again for joining us, and it's really great to have the chance to take a bit of a step back this morning and review and share thoughts with you, because, you know, there's no question this has been one of the most intensely challenging periods in my experience at the foundation, which obviously reflects the intensely challenging things that are happening for our locality, our sector, the world right now. So just to give you a couple of quick updates, a bit of an overview of what's been happening since our last session in November. Basically, since April 2020 and December 2020, that's the first 3 quarters of the financial year, we've distributed 4.6 million. So that is actually more than in the whole of our preceding year, and with all the complication that comes with a substantial adaptation of our regular funds, never mind incorporating emergency response funds. It's been intense, and I pay absolute tribute to the foundation team. I hope you'll forgive me using this opportunity to say thank you publicly to them, because they have done an incredible job. All during the, I mean, they do anyway, but absolutely during these very, very challenging periods of lockdown, and with such a great deal of need for their work and support across our sector. And all that hard work has been worth it. The importance of the funds flowing into community groups actually means that we didn't see the disintegration of our sector, which we feared during the early part of lockdown. We were very worried, as I know I shared with you before, that a lot of the third sector groups that work with beneficiaries might have to furlough, and what that would mean was there would be no contact for the beneficiaries that depend so much on the groups that we work with. The majority, as you know, of the groups we work with are those grassroots local community groups, and they absolutely depend on the bits of finance that we're able to channel through to them. So that concern, I guess, to start with a little bit of a concern, it has now translated into 2021's challenge, because like so many, we also face a funding edge as a sector at the end of March. So to that end, we're basically doing all we can to support those groups that we've managed to help support so far, and that's been primarily through the launching of the Leeds Fund resilience grants, which have been designed to support core multi-year funding for grassroots community organisations in Leeds to ensure their survival now and in the future. And clearly we're incredibly focused on being able to launch a very similar programme in Bradford soon. And with a fair wind, we hope we'll be able to do that. One of the hardest things for our operation, especially when it comes to raising these vital funds, is actually keeping our profile and message in people's minds when they're thinking about their own philanthropy. And the comms team at the foundation do a sterling job always, but they've really pushed hard during lockdown to grow the channels to stakeholders and audiences as much as possible. Thank you as our supporters for all you do to amplify our messages. It's hugely valuable. Your support in retweeting or sharing on social media is absolutely invaluable in reinforcing and validating, in raising the profile of the work that we do together. So please keep doing that if you can. And to that end, we've recently launched a brand new pair of podcasts. This was very much Rachel's baby, and she's done an amazing job putting those together with Michael and Laura. Give Love Leeds and Give Love Bradford are two new podcasts, which if you have time, and I know it's challenging for time at the moment, but if they're really well worth a listen on Spotify and iTunes. It's great to hear the experiences of communities on the front line in Bradford and Leeds. They're just so magnificently inspiring in these dark days. And I think we can share the links to those in our follow-up email. So hopefully you'll get to see those quite soon. But I think it's fair to say that the coronavirus pandemic has been exceptionally challenging and worrying times for each and every one of us. You know, we laugh about the effects of social distancing and kind of, you know, virtual elbow bumping and the time that we spend on Zoom. But, you know, all of that plus loss of loved ones to the virus and very stress-inducing media reports, it does take a grave toll on our mental health and well-being. And Mind recently shared some very worrying findings about more than half of adults and over 2/3 of young people reporting that their mental health has worsened during the period of lockdown restrictions. And all of that, those factors about not being able to see people, go outside, worrying about family and friends and their health, the key factors in driving poor mental health. And clearly loneliness has long been recognised as a key contributor, which many people don't feel entitled to seek help, even when they absolutely need to. And some people also have difficulty accessing it. 1 in 3 adults and more than 1 in 4 young people didn't access support during lockdown because they didn't think they deserved the support. So it's a worrying picture, and not just for now. Also, the long-term effects of mental health we know are very, very significant on our people. So over the years, I know long-term supporters will recall that mental health has been something we've been championing and investing in since 2016 in various funds over the years, focusing on mental health, particularly through the Leeds Fund, but also men's suicide prevention and Time to Shine, working on seasonal loneliness. And some of our individual donor funds have also supported that work brilliantly. Just sort of grouping that together, it's well over £1 million into 73 different groups supporting hundreds of Leeds people. And recently we're looking again to support similar kind of work across Bradford. Further, there's a new fund which is focusing particularly on mental health inequalities in ethnic minority groups and addressing self-harming in Leeds programmes.